Hello and welcome back to GP Video Podcast by Nadia. So as you guys know that obesity and metabolic syndrome is one of my most favorite topics. Then after that, mental health is one of my most favorite topics, and I started talking about anxiety disorders this morning. Mental health, obesity and metabolic syndrome, and then third one is women's health. Women's health is also one of my most important, liked subjects and topics, because we do get a lot of women in general practice presenting with different problems. Okay, I'm sure you guys have all heard a bit about endometriosis. If you have not, then I would be telling you today and in my upcoming video podcasts. Endometriosis is a disease in which tissue similar to the lining of the uterus grows outside the uterus. That's as simple as that, the definition. So as you would know, all the internal organs almost are made up of three layers. One is the outer layer, then is the muscular layer, then is the inner layer. Okay, so the inner layer in the uterus is called endometrium. The muscular layer is called myometrium, and then there is an outer layer which is, I don't know what is it called, but it is, so there are three layers: the outer layer, the muscular layer or the myometrium, and then endometrium, which is the endothelial cell lining of the uterus. So endometriosis basically is the disease in which this tissue, which is similar to the lining of the uterus or which is like endometrium, grows outside the uterus in other organs. So that is called endometriosis. It can cause severe pain in the pelvis and make it harder to get pregnant. So it can grow in ovaries, it can grow in fallopian tubes, it can go in urinary bladder, anywhere, and because it is outside the uterus, it can cause a lot of pain. So basically, what is it? It is a chronic disease associated with severe life-impacting pain during periods, sexual intercourse, bowel movements, and or urination. Because whatever objects are there around the uterus, like let's say urinary bladder, rectum, fallopian tubes, ovaries, so it can grow anywhere in the pelvis. It can actually grow anywhere in the pelvis. So it is a chronic disease associated with severe life-impacting pain during periods, sexual intercourse, bowel movements, which is like passing the stools, and or urination, chronic pelvic pain, abdominal bloating, nausea, fatigue, and sometimes associated depression, anxiety, and infertility. There is currently no known cure for endometriosis, and treatment is usually aimed at controlling symptoms. Basically, what is done is, if they can remove it surgically, that is actually the cure. But otherwise, there is no medication to be able to cure it. Access to early diagnosis and effective treatment of endometriosis is important, but is limited in many settings, including in low and middle income countries. So as I said, that endometriosis is a disease in which tissue similar to the lining of the uterus grows outside the uterus. It can cause severe pain in the pelvis and can make it harder to get pregnant. So there could be secondary infertility or even primary infertility as well. Endometriosis can start at a person's first menstrual period and last until menopause. So basically, it is a hormone-related condition which can start at first menstrual period or menarche and can last until menopause, which is the last day of the last menstrual cycle. With endometriosis, tissue similar to the lining of the uterus grows outside the uterus. This leads to inflammation and scar tissue forming in the pelvic region and rarely elsewhere in the body. So usually it's outside the uterus, but it is still in the pelvis. But very rarely it can be elsewhere in the body as well, like upper abdomen or chest or somewhere else, but usually it's in the pelvis. And you would ask that, okay, if it's just the lining of the uterus and it's outside the uterus, what is the problem? The problem is that because it's out of the place and it's in or around the other organs, it actually causes inflammation and scar tissue formation. The cause of endometriosis is unknown. There is no known way to prevent endometriosis. So because no causes are known, there is no known way to prevent endometriosis. There is no cure, but its symptoms can be treated with medicine or in some cases surgery. So symptoms can be treated, can be masked, like for example with pain medications, with hormonal medications, but Usually there is no way to stop it from happening, but surgical removal of the endometriosis is very much possible. It causes a chronic inflammatory reaction that may result in the formation of scar tissue, adhesions, fibrosis within the pelvis and other parts of the body. Several lesion types have been described. Okay, now what are the symptoms? Endometriosis often causes severe pain in the pelvis. So severe pain, which can be chronic steady pelvic pain, or pain during periods, during urination, during defecation, during sexual activity, pain during all of these kind of activities, and especially during menstrual periods. So especially during menstrual periods, it can be really painful. Some people also have pain during sex or when using the bathroom. Some people have trouble getting pregnant. Some people with endometriosis don't have any symptoms. For those who do, a common symptom is pain in the lower part of the belly or pelvis. Pain may be most noticeable during a period, during or after sex, while urinating or defecating. So again, there are 3 periods: during the menstrual periods, during or after sex, and when urinating or defecating. So pain is most noticeable then. Otherwise, there could be a chronic steady pelvic pain all the time as well. Some people, as I said, also experience chronic steady pelvic pain, heavy bleeding during periods or between periods. So usually heavy bleeding is not the symptom of endometriosis, but it could be, because bleeding is usually coming from the uterus, and this is the endometrial lining outside the uterus. But still, people can also experience heavy bleeding during periods or between periods, and then trouble getting pregnant, bloating or nausea, fatigue, depression or anxiety. So these can all be the symptoms of endometriosis. Symptoms often improve after menopause, but not always. So it starts because endometriosis, what is endometriosis? Endometriosis is the growth of the endometrial lining. Who is responsible for the growth of the endometrial lining? Estrogen. So that's why it starts from menarche and ends by menopause, because this is the time period where the hormones are at their highest peak levels. After that, they fall down. So that's why the symptoms ease after menopause. Endometriosis symptoms are variable and broad, meaning that healthcare workers may not easily diagnose it. Individuals with symptoms may not be aware of the condition, because usually pain is the most important and cardinal feature. After that, heavy bleeding is another feature. Then trouble getting pregnant, bloating or nausea, fatigue, depression, anxiety, all these could be the features as well. I'll come back to this topic next time.